All right, and welcome to part three of Wearing the Mask and Other Good Things You Should Do, a public health discussion of why we do the things we do. Now, in part two, we talked about the socio-ecological model, which is a framework we use in public health to help frame and describe the different influences in our life that impact the decisions we make literally thousands of times a day. Now, in this part, we're going to talk specifically about the COVID-19 pandemic and the science behind the suggestions that are being made to help reduce the possibility of transmission of the coronavirus. Now, the big three of transmission prevention that have gone with us from the start of the pandemic up till now are focused on one, wearing a mask, two, practicing social distancing, and three, good hand hygiene. But before we get to the science behind specifically those items, I want to talk a little bit about how we even get to public health recommendations as a general concept. Now, there are different ways it can come, but the bulk of the recommendations that are provided come through high quality, peer reviewed research. Now, as the graphic suggests, this takes time, and it can be a very long process to get from the start of the process to what we ultimately make recommendations for the public. So the very start of this involves conducting research. Now, research studies can take, on the very short end, months, but oftentimes can take years and years to actually conduct. Now, after the research is finalized, well, then we need to talk about what happened. And we call this dissemination. So basically taking what can be massive amounts of data and information and trying to condense them into different messages that we can use for the greater good of the public. Now, once we disseminate and we spend a lot of time writing and putting things together, ultimately you have to submit your work. Now, the submission process results in what we call a peer review process. Now, this is where peers in your field, not necessarily people you know, but other people in your field look at your work, look at your research through an objective lens, and after that decide the strengths, the weaknesses, and oftentimes the revisions that they would like you to make before it can ultimately be shared. Now then, after that, you receive back your work, you go through your revisions, and you submit, and sometimes there's a back and forth that can take months, sometimes up to a year or two, or even longer. So the point being, it's a very long process from the very start to the very end, with the end being when we ultimately make these high quality, research-based, peer-reviewed research-based recommendations. Now, the COVID-19 pandemic, the first US case was actually in January of 2020. So that means it's only been in the United States for 6 months, a far shorter time than is required for the process I just described. So what can happen as a result of this? Well, with the lack of high quality peer-reviewed research specific to COVID-19, it opens the door wide open for conspiracy theories, for pseudoscience, for not well-reviewed research that pops up on our social media feeds, and sometimes in the mass media. But we do have these recommendations, the hand washing, the mask wearing, the social distancing. Where do these come from? Well, they come from the field of infectious disease epidemiology. Now, just because we don't have years and years of research on COVID-19 specifically, we do have massive amounts of research on infectious disease and the steps and the methods we can use to reduce the possibility of transmission. So the previous peer-reviewed research on the common aspects between COVID-19 and other infectious diseases are what we cite and what we really rely on. Now, these categories include the preventing of transmission in the air and also the reduction of pathogens that live on surfaces. Now, the graphic on the right shows an article that just came out in The Lancet, which is a highly respected, highly regarded medical journal that goes globally. And they basically used this idea. They looked at the previous research that has existed through a meta-analysis, which means it's a combination of many, many studies to talk about how we got at the recommendations that we are making. But it should be noted that as we learn more specific to COVID-19, adjustments can be made to the specifics of the recommendations. So now, the recommendations themselves. First, washing those hands. The recommendation is frequent washing of hands with soap and water for at least 20 seconds. Now, you might have seen on YouTube or on your Facebook feed, different people singing songs that last 20 seconds. So you know what? Go ahead and do it. Sing the song for 20 seconds in your head, out loud. It doesn't matter. It's for the greater good. If you can't wash your hands or you're in a place where you need to sanitize, the use of hand sanitizer with at least 60% alcohol is the recommendation. Now, the science behind it, hand washing can reduce the spread of the coronavirus directly and indirectly. And it does this by removing pathogens that live on the surfaces that we touch all throughout the day. The next recommendation is social distancing. Now, specifically, you should attempt to stay 6 feet away from other people. The science behind it? Well, the primary way in which the coronavirus is spread is through the air. And this is through droplets and aerosols that are produced by us all throughout the day. Now, these go into the air through coughing, through sneezing, which has force behind it, which can cause the droplets to spread further into the air and further into the area around you. But as we learn more and more, we know that this same phenomenon happens through talking. Now, there's not as much force behind your everyday speech. However, we do a whole lot more talking than we do coughing and sneezing. So the massive amounts of aerosols, of droplets that are expelled through that way, all suggest that keeping 6 feet away from one another can help to reduce the number of droplets that we ultimately inhale into our own lungs. Now, the final recommendation is on wearing a mask. Now, this is the most controversial of the three. Now, the recommendation is that we should wear a cloth face mask when social distancing isn't possible. And as we go throughout our day, and as things start to open up more and more, social distancing isn't always possible. So it's a good idea to wear a cloth face mask whenever you are out and about. Now, the science behind it is that wearing a mask acts as a barrier against expelling and, to a smaller degree, inhaling these droplets. Now, the amount of protection that you ultimately get, it's somewhat complicated. Now, the best masks are the N95 surgical masks. However, these do remain in short supply and should be reserved for healthcare workers who are working with vulnerable populations for long periods of time. So the most available option for us are cloth masks. Now, limitations for cloth masks, and if you've worn one, you know this, they're not exactly form-fitting. And so, because there are these gaps, they don't prevent all droplets or aerosols from being expelled into the air or inhaled from it. And also simply the fabric, the cloth fabric, is not as great of a barrier as these N95 surgical masks. The strengths of them and their utility: one, they're affordable and they're easy to make, and they're capable of keeping large droplets, often from a cough or sneeze, from going into the air. So what should you do? My main message to you in terms of which behaviors you should do is that this is not a buffet. We cannot pick and choose one or two. We need to do all three, because each measure, hand washing, social distancing, wearing a mask, they each contribute to reducing the spread of the coronavirus in different ways. And so it is vital to practice all three behaviors. Now, we should note that these behaviors, individually and even collectively, they're not a foolproof force field against the coronavirus. But all three of them, when done collectively, they do provide the best way for us to be proactive and to do our part to prevent the spread of the coronavirus and keep us a healthier and happier St. Ambrose University. Now, in our final part of this short course, we will tie together the socio-ecological model and the three behaviors and talk about how they influence ultimately how we act in preventing COVID-19, but also what you can do to influence these influences that impact your behaviors.